Hi, everyone. I'm Dr. Carolyn Ross, and I'm here with Leslie Bench, who you all know and love, I'm sure, as much as we do. And Leslie and I are going to be talking about the whack-a-mole phenomena. And I'm not going to get into it right now because I want to, go through the webinar. But basically, we'll be telling you what whack-a-mole is and how it shows up. And you can identify maybe if you have the whack-a-mole phenomena. And then we'll tell you a little bit about what you can do about it. So let's get started with the webinar. I'm going to just share my screen here and get the slides going. Okay, so it's cross-addiction or whack-a-mole phenomena. So basically, the question that we can start with is, what is cross-addiction? And I can explain that just by saying that you may have had an alcohol problem, or maybe you had a drug addiction or gambling addiction, and then you got clean and sober from that, and the next thing you knew, you were overeating or developed bulimia or anorexia. So we know that for people who've had bariatric surgery, for example, a large majority of them end up having the whack-a-mole phenomena, end up becoming cross-addicted, particularly to alcohol, but there can be sex addiction, gambling, and other addictions that pop up. Right, Leslie? Do you have anything to add to that?
Absolutely. So I see things in two different areas. One, as a clinician working in a treatment center, even in treatment when clients are abstaining from drugs and alcohol, sometimes they'll start shopping online.
Yeah. Oh, that's right. Don't forget about shopping.
Let's not forget about shopping. That's a big one. And also I did see, clients who never had issues with food, who got sober from alcohol, really, or drugs, really just started, eating their feelings, basically. That's what
and it's interesting because when we see an alcoholic who starts putting on weight after getting sober from alcohol, nobody really thinks of that as being an eating addiction or a food addiction. But, over time, the eating problem can take over and cause as many or more health problems as the addiction originally did. So it doesn't necessarily mean cross-addiction isn't about you being addicted to alcohol and opiates or alcohol and methamphetamine, although that happens as well, and sometimes we see it that way too. But sometimes, like Leslie said, it's related to things that you don't even think are addictions, like shopping or relationship addictions. We see that a lot in young women, particularly, who get so attached in a relationship, and that can become an addictive behavior. And, eating disorders are considered a form of addiction. So when we talk about bouncing from drug or alcohol problems or sex addiction or shopping to an eating disorders are considered process addictions, meaning the addiction is not to food, not that the food is addictive, it's that the behavior, whether it be restricting or overeating or binging, those are the behaviors that we find that are addictive. So let's talk about what does it mean when we say whack-a-mole.
So I think this term maybe got coined in the treatment center environment. Yeah. I think it's a really helpful reference for people, and I think this is a really good thing to talk about today because, like you said, we don't always know when we're doing these things. So a good therapist in a treatment center, just quickly for this example, would really begin to be able to say to the client, oh, we're doing the whack-a-mole because first we're putting down the drugs and alcohol. Hey, but like you said, the food thing gets a bit underreported, but certainly if a client is engaging in flirtatious behavior with another client, or, is obsessing about other things like, money or again, shopping because they may have access online. So from that, I think to bring it into the general idea of the clients that we see in our private practice, it's really important for people to be aware that this can actually happen, and that it's not, a judgment or it's your character. It is just that, wow, I noticed that I have put on X amount of weight since I stopped drinking. I think that's a really good example. And as you said, all of the other types of eating behaviors can arise and other things.
Yeah, and I think it really goes to what we're going to talk about next, which is, why is there this whack-a-mole phenomena? You would think, well, I got rid of my alcoholism. Now, why am I really struggling with food? And I think it goes to what the essence of addictions are and where they come from. We know that addictions have a genetic basis. That's part of it, yes. 50 to 60% of addictions can be considered to be related to genetic causes. There's also the component that addiction is about, of any kind, whether it be shopping or whatever, it's about giving your power away to something outside of yourself. So I can say that I probably have had a shopping addiction over time, and I know that for me, shopping, I would engage in excessive shopping when I was stressed or anxious or, had a big event coming up and I had to look just perfect. So I had to buy, expensive clothes to look just perfect. And that was really more me giving my power away to, having a certain clothing or having a certain look than anything else. And I think that is one of the common things that we see with all addictions. I don't know if you have anything to add to that, Leslie.
I think it was also, in this case that you were giving about yourself, a way to manage the anxiety or the emotional, wave of stuff that was coming up around the event, or what was, even going on in your life while you were having to go to this event.
Yeah, that's really true. And that's why we talk about addictions not being the problem, because everybody focuses on addictions as the problem that has to be fixed, when in effect, the addiction is really the solution for the problem. So my shopping addiction was the solution to my high level of anxiety and my inability to effectively deal with the amount of stress in my life. And I think if you think about that, you'll see that in other addictions as well. For some people, their drug or alcohol addiction can start as a way to deal with other issues that have come up in their lives too. But we're going to talk more about that in a moment. I think the question that really we need to talk about is whether or not addictions, even eating addictions, are a moral failing. We have so much stigma attached to addictions, and oftentimes we judge people who have an addiction and say that they're weak. They just can't get their lives together, or, we even say they have a disease, which is true, but it doesn't seem to rid us of stigma that we have for people with addictions of all kinds. And so I think the question starts with, what's wrong with you? We say that to family members with addiction, and then they start to say it to themselves. They feel the same kind of shame and guilt and disgust with themselves, and often will turn that question on themselves. What's wrong with me? Why can't I get my life together? Why am I so weak? And that's really not where we want to go with this. That's not what addictions are all about. So I want to just give you kind of the official definition of addiction, and this is from the American Society of Addiction Medicine, who says that addictions are a primary chronic disease of brain reward, motivation, memory, and related circuitry. So I've highlighted a couple of words here. First of all, it's chronic. So when we ask our loved ones, or when we ask ourselves, why can't we just get over this? You have to realize addictions are a chronic disease. We never say to someone with diabetes, why can't you just get over your diabetes? We don't do that. But we do that for people with addictions, and that's inappropriate. It is a chronic disease. The second big point is that it affects the brain. So you can't have a brain transplant. So we have to work with what the brain is dealing with. And we'll talk in a moment about the reward center in the brain and how that's affected, because that explains how all of the addictions kind of come from that same place. You know, we have the genetics, we have other issues that can cause addictions, but we also know that the brain reward center is affected by a lot of things that we'll talk about in a minute. And that is the underlying cause of addictions. So that's one of the reasons why we have the WhackAMole phenomenon. So right now we're going to talk about a couple of cases just to give you kind of a flavor of WhackAMole and help you identify whether this is you, because you may be dealing with the same thing. I know Leslie, just like myself, we work with a lot of clients just like you who are, you know, struggling with understanding, like, why am I having this problem when I took care of the big problem and now I have this other problem and it seems like I'm out of control with my eating or I'm binging and purging. So the first case I'll let Leslie tell you about.
Before we go to and I'm going to talk about this in 1 second, I just wanted to tie in something that you said that I think is really important for people, you know, for maybe the person who's watching this can understand, well, how does this brain thing then tie in with these judgments where people say, oh, how come you can't get over this? Or that you say that to yourself, or I am just weak. And you said it earlier, and I think it ties this together, is that this is a solution. Yeah. That these behaviors are trying to solve some underlying things. So, and we're going to talk about that, but I think that's just so important, that it's not this moral failing, that your body and brain actually think and feel, because of that reward center, that this is solving the problem. That
absolutely, and we're gonna go into that in more depth in just a moment. So I'll let you talk about this case of CrossAddiction or WhackAMole after bariatric surgery.
Mm-hmm. So this was one of my first experiences with WhackAMole as a clinician, in the fact that I saw it so clearly. We had a client who had had a compulsive eating issue, was very overweight, and really just wanted to end that cycle. And she thought that the bariatric surgery was the perfect thing to do it. After she had the bariatric surgery and lost a significant amount of weight, she began to notice that her desire for alcohol became a little bit more apparent and a little bit more in her life. And slowly she developed an addiction. Actually, not so slowly. I think it was in the first 2 years following surgery. She wound up getting a DUI, getting, you know, driving while under the influence, and, you know, lost her driving privileges. It became, you know, one of the fundamental things that led to her divorce. And so it really did create this whole problem. We really took a look at, wow, you went from this to alcohol in such a short period of time, you didn't even see it coming.
Yeah, so and that really points out the point you were making about it's a solution to a problem, and the bariatric surgery cannot solve that problem because it's an underlying problem. And so people just are uncomfortable, like I was with my anxiety, and I just, you know, you just go and you try to find something to help you. And oftentimes you're not even thinking about it, but, you know, it creeps up on you, and next thing you know, you're being stopped by the cops for DUI. Mm-hmm. So we have another case for you that is about a patient with CrossAddiction and anorexia. So actually, I've seen a number of people like this, and some of you listening may have experienced this as well, but this was a client of mine who had pretty severe anorexia, and what she did was she also had once her anorexia started to improve, again, she started drinking more. Sometimes it also happens that during anorexia, people will have a pretty strong alcohol use disorder as well, and they will have this complicated, pattern where they trade alcohol calories for food calories. So, well, I'm going to drink tonight, so I'm not going to eat because that'll be too many calories. And then, that can become more of a problem over time. Have you ever seen any clients like that, Leslie?
Oh, absolutely. Absolutely. And so it's really sad because they cannot get nourished enough with the food because they want to use those calories for alcohol.
Yeah.
So it really impedes the recovery for the anorexia and then increases the substance use disorder, the alcohol use disorder.
Yeah, absolutely. So I just want to talk a little bit about kind of the sort of things that can be a problem in certain conditions, especially with alcohol. As I said earlier, actually about 21% of people who've had, some type of bariatric surgery, of any of the bariatric surgeries, develop a drinking problem within, several years. And the alcohol problem doesn't always show up right away, and doctors don't always ask about it in bariatric surgery patients. So they continue to, drink, and that can cause problems with their nutrition because bariatric surgery in and of itself causes a form of malnutrition. That's why it's so important for the people who've had bariatric surgery to stay on their vitamin regimen. We also know, though, what's interesting about this is that some of the animal research is showing that certain types of bariatric surgery can actually affect the brain reward center, which I'm going to be talking to you more about. So the surgery itself can cause problems in the brain reward center, maybe creating an increased sensitivity in the brain reward center to alcohol, meaning that alcohol becomes even more of a feel-good chemical for them. It just gives them more reward. So this is something that hasn't been addressed in a lot of patients who have had bariatric surgery and then go on to develop a drinking problem. The other special population are, as we talked about just briefly, is anorexics who develop a drinking program. It's not a program, a drinking problem.
Yeah,
Anyway,
which becomes their program.
Yeah, becomes their program, that's for sure. But in one research study, they found that it not only occurs in anorexics, but 8 to 40% of bulimics can develop a substance use problem, and up to 25% of people with anorexia can develop substance use problems. And about 50% of people who have an eating disorder are also abusing drugs and alcohol. So, that there's a lot of whack-a-mole going there. And I've seen over and over and over how, in the eating disorder populations, when the eating disorder gets better, then the cravings for drugs and alcohol get higher. And although calories are, pretty high in alcohol is pretty high in calories. In eating disorder patients, it can cause a lot of stomach problems. It can also cause dehydration. It can trigger what we call reflux or GERD, and really can cause problems with eating disorder recovery. Did you have anything to add to that, Leslie?
I was paying attention to what you were saying in terms of how both drugs and alcohol can really play into the whack-a-mole. Mm-hmm. I was thinking recently of a client who is now in treatment, thank God, but used opiates. Well, she used Xanax, which is different, but she used that to sleep as much as she could. So if she slept as much as she could, then she wouldn't eat. So it was an interesting relationship between that particular drug and a way to actually exacerbate her eating disorder.
Yeah, wow.
Yeah, just,
People with eating disorders can be very creative in this way, right?
Mhm.
So I think we have one more case, compulsive overeating and exercise bulimia. Do you want to
Mhm.
go over that one, Leslie?
Sure. And little disclosure here, I've had some experience. This is some of my own experience early in my recovery. Um, so in my own recovery, I needed to stop drinking, but the compulsive overeating was significant. And then, from that became the obsessive counting of calories to try to lose the weight. But then what I discovered was, oh, well, if I exercise this amount, then I can get rid of what I just ate. And I thought I found this wonderful way to diet and lose weight and get healthy. And you know what? After, I would say, less than a year, it was insanity. The amount of exercise, which was leading to injuries like shin splints and shoulder stuff, and I do see that, and also in my practice from mostly women who exercise too much for the compensatory calorie thing. So that was just shocking to me when I finally did get into therapy, and my therapist pointed that out.
I just want to make sure everybody understands what you mean when you say exercise bulimia,
Mm-hmm.
because bulimia basically is binge eating alternating with what she said are compensatory mechanisms to get rid of the calories. So that could be purging through self-induced vomiting, or it could be getting rid of calories by exercising more than you would normally exercise. And as Leslie said, it can lead to a lot of problems with injuries and excessive weight loss, and many of our anorexic clients have that as well. And I think it's very common in men. It's just that men don't come forward. I think we see a lot of this in men, um, but they're given kudos for spending hours in the gym. So that's a little bit different issue. Yeah, you were saying?
Yeah, and with the compulsive overeating and then trying to figure out the calories and then having to go to the gym or get on the treadmill and do all of those things to lose the calories, what a distraction. That's a really good example for me of not wanting to deal with the underlying feelings, didn't know how to deal with them. But this whole thing, which could take up hours and hours in my day, was a great way for me not to feel, for me to stay somewhat steady. I didn't know how to deal with all the emotions that were underneath all of that. So once again, not about the actual eating, not exactly about the exercising, but what it was trying to compensate for.
And that's what we're going to talk about now. I think the causes of cross addiction. So this slide gives you just a little hint of what we're talking about, and that has to do with the brain reward center. So we know that there's a part of our brain that gives us pleasure when we do pleasing activities, whether it be watching a sunset or having a piece of cake or drinking or fill in the blank. So that's a natural mechanism in our brains. And anything that gives you pleasure feeds into that mechanism. Now, there are some issues that come up when, children have had problems bonding with parents or caregivers, or when they've experienced certain childhood experiences, that can affect the way that the brain reward center works. And then it can make it more difficult for people to experience pleasure from the normal things that we all like to do. And so then you may find them, being thrill seekers or using drugs or alcohol. So the brain reward center is maybe not functioning in the way that it should, and that can be genetic. It can also be related to childhood experiences. It can be related to relationships in your childhood with your parents and caregivers and so on. But the bottom line, as Leslie has said, and I think we've both said throughout the webinar, is it's not about the food, it's not about the shopping, it's not about the alcohol. It's really about the pain. We know that while that adverse childhood experiences or any kind of really seriously negative childhood experiences, any experience that makes you feel as if you've lost an essential part of yourself, whether it be your security, your safety, your feeling of peace. Obviously, serious abuses like, sexual abuse, other traumas that children experience can cause those problems. But when you've had adverse childhood experiences, that loss of the essential part of yourself, you are more likely to be at risk for eating disorders, addictions, attention deficit disorder, and a host of other compulsive and impulsive disorders. So the Buddhists say that pain is part of the human condition and that suffering is caused by craving, wanting things to be as they are not. So because of that unique combination that many addicts and eating disorder clients experience as children of having genetic risk, having adverse childhood experiences, and maybe having problems with bonding with their caregivers, they may have these cravings for drugs and alcohol, which is because of the underlying feelings that they're not able to cope with. Anything you want to add to that, Leslie?
I think when a person who has had early childhood things, such as you were talking about, and then covers up and develops this sort of aversion to pain, aversion to suffering, what I can pretty much guarantee is the things that they are doing to not feel, usually over time, create all of the problems in their life that, then they have no choice but to learn how to feel. And I feel really, passionate about helping people, because once they do get to that, once they do understand how to process feelings, their lives really do get a lot better.
Yeah, and what I've noticed is how much we are afraid of addressing those feelings. And I think that comes from the fact that often experiences like that happen when we were younger and we didn't have any skills to manage. And so we still feel that sense of, oh my God, what am I going to do, from our younger years, not recognizing that even though we may be struggling with drugs or alcohol or eating disorders right now, we are adults and we have developed different levels of skills than we had when we were 3 or 5 or 7. Mm-hmm. And so I have so many people, probably just like you listening today, that find, oh my goodness, I thought this was going to be so much more difficult than it is. Mm-hmm. And it's such a relief to get into this and finally find that there's nothing wrong with you. It's not about what's wrong with you. It's really about what happened to you. And what happened to you could be anything from having a parent with drugs and alcohol, or, having a parent with a mental illness, having someone in your family who's been incarcerated. All those things are adverse experiences for children. And we don't realize, we're so busy as adults, especially when it's happening to us too. We don't realize then that, wow, our children are going through these same experiences, like a divorce or, a husband who's, drinking. And we're trying to deal with them from the adult level, but they're trying to deal with it from being a child, which is, it has got to be even more frightening and traumatic. So we want to shift the question from what's wrong with you to what happened to you and what can we do next. So I know you want to talk a little bit about some of the other effects of trauma on people with eating disorders and addictions.
So I have up here the two titles here is hyperarousal versus hypoarousal. So have you ever found yourself extremely agitated, anxious, flooded, overwhelmed, crying, can't stop, and that becomes so uncomfortable. That would be an example of hyper arousal, where you're just very activated, and what you want to do is calm down. You want to get back to maybe just feeling a little less triggered or anxious or panicked.
Or it could be anger too, right? A lot of people express it as anger. Yeah.
Absolutely. Rage. Where you just feel like, oh, that would be that's hyperarousal. Whereas hypoarousal is feeling numb, really checked out. How about when you could be driving and you just don't even know, wow, where was I for the past 20 minutes?
Yeah.
Hypoarousal can also feel like depression, lack of motivation, just that lethargy that comes over you, and you don't really have a physical cause for it. It's more of an emotional thing. And you may, in that point, want to feel something again, to feel a little more excited, a little more alive. And, both of these states can happen to us as normal human beings. And then both of these states can happen when we are involved in cross-addiction. And when we are doing different substances, alcohol versus pills, food versus, shopping, each can give us different states of hyper or hypoarousal as we need it.
So you're saying that people might be using like food or shopping or drinking to either bring themselves up if they're too lethargic, or to bring themselves down if they're too hyper aroused.
Yeah.
Okay. So basically, I think for people who are watching the webinar, you might just look back in your life and notice, like I mentioned to you, when I felt anxious, I wanted to go shopping. So you might look back in your life when you have periods of stress or anxiety or anger or, whatever the unpleasant emotion is. How did you feel? Were you hyper aroused or hypo aroused? So remember, Leslie said, if you were hyper aroused, you wanted something to calm you down because you're either too anxious or you're raging or you're too stressed. And then you may seek something like, oh, I'll just have a glass of wine. Then that becomes 3 glasses, or I'll just go shopping, etc. And then if you're hypo aroused, you'll feel like numb, can't get out of bed, lethargic, blue, and you want something to pick you up. And so you may use food as a pick-me-up, or you could use, fill in the blank. So just see if you can connect the dots for yourself to see what state you go into, and then how do you try to fix that state with whatever behavior that you're using. Anything more from you on that, Leslie? That's a great point to bring up. I love that.
I'm going to just speak to, and I don't know if this is necessarily your audience, but they may know someone or be in recovery. Sometimes when people are in recovery from certain substances, they're going to feel that trough of hypo, that down, because they have stimulated their brain so much with maybe caffeine or other drugs that they, or who knows if alcohol, but they're going to have that period of time in their recovery where they're going to feel less than great. And this may be another reason why they go to the WhackAMole, because they can't tolerate that early recovery stuff before their brain gets kind of balanced. I don't know if you saw that too in your patients.
Yeah, well, I know you talk all the time about the pink cloud. I think early in recovery, people are in the pink cloud where everything is beautiful and, people are starting to reconnect with you and you feel so great. And then real life comes back. You have to get a job. You've got to pay off your debts. You have to make amends, all of these kinds of things. And that can make your mood go from the pink cloud into that trough that you're talking about. And then, I have patients come to me all the time, maybe like some of the people, maybe just like you who are watching the webinar, who come to me and say, well, I'm up one day and down the next and da da da. Is that normal? And yeah, it is. It kind of, that's the way life is, that sometimes you can't be up all the time. That's what many of my addiction patients think, that, oh, now I'm not using anymore, I should be happy all the time. And it's not like that. Real life is flat sometimes, it's up, it's down. It can be all around. So it is an adjustment as your brain starts to come back from the pink cloud and from all the use. Yeah. So let's just, we just want to talk a little bit about things that you can think about in terms of things you can do. So obviously the first step is awareness. And that's why we've done this webinar, to help you become more aware of what the WhackAMole phenomenon is. And, recommend that you work on those underlying root causes, whether it be trauma or, times in your life where you have felt unsafe or, scared or whatever. And I think we have a lot coming up on the Facebook group, where you'll be able to learn more about things that you can do here. And one of those now is just downloading the ebook. So I'll put the link in the webinar posting here for the ebook, just so that you can be aware of a little bit more in depth about what we're talking about and how you get to the root cause. Do you want to talk about the solutions, Leslie?
Oh, yeah. This is where I think the joy is the journey, if I could quote that. I love that phrase. First of all, just looking at this webinar, downloading the ebook, looking at different patterns of your eating can begin to start you on that journey. Again, when we have this iceberg, we're looking at what are the behaviors. Oh, I'm eating too much. Oh, I eat one day and then, don't eat the next day, or whatever the patterns are. And we talked about drugs and alcohol and shopping, etc. But the solution certainly can look like, how about getting into therapy, support groups, a Buddhist practice, yoga. These are things that I know that they sound great and they're probably very good for you. But because they do have a really positive effect on the brain over time, to help some of that hyper arousal stuff, and also give you some resiliency within yourself.
And I think the most important thing is for people to give themselves time and to be kind, and to recognize that it is a chronic disease. Just because you stop drinking or stop, you do have to take the time to go deeper below the surface of the iceberg, where most of the problem lies below that surface. And that's what the ebook does talk about, is how to, is about that, what's beneath that. And if we don't work on what's beneath the surface, then we just keep doing the whack-a-mole, whack-a-mole, whack-a-mole. So my hope is that everyone listening here will really take this seriously. And I'd love to hear your comments. I know Leslie would too. We just love it when you tell us what you're thinking and what your experience has been. Because I know some of you out there have shared with me that that you've been experiencing whack-a-mole, and you're really puzzled by that. Like, I stopped drinking or I stopped using drugs, and now, my weight is out of control and my eating is out of control, and I just don't understand it. So that was one of the reasons why we wanted to put together this webinar, to give you a little bit of background. And this is all part of what we're doing on the Finding Your Anchor Facebook group. So if you have any other questions that have come up during the webinar, please put them in the comments section, and Leslie and I will be looking for those. And in the meantime, download the ebook, and we will look forward to seeing you in the group. Any last minute words, Leslie?
I think that it's really about, when you say awareness, just doing one small thing can really, really help. Do what you can, not judge yourself about, oh, I didn't do enough. Just do what you can and keep putting one foot in front of the other.
Yes. Awesome. Awesome. Thank you so much. It's been fun being with you again, and I hope everyone has enjoyed the webinar on WhackAMole.
Thank you.